Okay, let's talk about healthcare program that you can start if you're looking to get a job in healthcare. So if you want to if you want to land into a quick job and you are looking for a short-term study, that is going to be HCA, which is a healthcare assistant program. Usually this program is from 6 months to a year that you can complete including your clinical placement experience. Second one is LPN, which is licensed practical nursing. And third one is RN, registered nurse. So RN is basically BSN. LPN is a shorter program like a diploma in nursing, but you get fundamentals of nursing, your basic knowledge, and there is a scope for LPN versus RN. LPN looks for stable clients, which you know the person is sick. These are the diseases, these kind of medications person needs, and after giving medications, this is the outcome gonna be. RN looks out after unstable patient where their health changes very quickly that you don't know the predictable outcomes. So this is main difference going to be between LPN and RN. You have different scopes. Certain things LPN cannot do, which RN can. And HCA, they don't have any scope or any specific responsibilities. But this is a certificate that you get, basic knowledge about how to take care of clients and how to provide client-centric care. So basically in healthcare practical nursing, it's called licensed practical nurse. Your responsibilities include taking vital signs, which are temperature, blood pressure, SpO2, which is oxygen saturation, taking pulse, assist patient with their daily activities, administer their medications, wound care, and helping patients mainly with their comfort and hygiene. And LPNs work in hospitals, nursing care homes, long-term care centers, clinics, and in community home healthcare agencies. So when you get into a nursing school, you need some prerequisite, and post-requisite. For practical nurse, the requisite is in Canada is you must have your grade 12 high school. You should pass that. Your English studies minimum B grade level is English studies 12. Some certain institute call it different level, as long as wherever you are getting into the program, admission checklist will let you know what kind of equivalent courses that they accept from different institutions as well. So maybe the course is called something else somewhere, but you need to check that if it's aligning with your admission requirements or not. You need foundations of math 11, and mainly it's 68%. You need a minimum C grade. Human anatomy and physiology is a must course that you require to take before getting into any nursing program. And English language proficiency test could be IELTS, it could be some other tests as well, which are required by your admission department in your nursing college. Once you get into nursing school, so the post-enrollment that you're gonna need is CRC, your CPR level certificate, which is A and C, your TB skin test or chest x-ray, making sure you don't have any respiratory issues or you don't have any allergies, skin allergies. The other one is you need your immunization record for all the listed diseases, and make sure you have your COVID-19. The mandatory are 2 vaccines in BC in Canada that you require to have, and your N95 mask fitting test for respiratory care. Like for COVID, you need to wear an N95 mask. So that fitting is really important. And also N95 is renewed on yearly basis. So every year, even if you're a nurse, you need to make sure you are up to date for those certificates, as well as the CPR, which is renews after every 3 years. So once you get into the school in LPN, normally there is BCCNM, which is called the British Columbia Nurses and Midwives College. So they have set some courses requirements and some skills that you have to have before you apply for your nursing license. So basically in term 1, you just focus on more foundational nursing skills, which is going to be communication, promoting health, pharmacology, knowledge about drugs, their side effects, which their action, which body part do they work on, and variations in health, and how a diseases impacts your health, what kind of variations comes into your body when certain body part gets infected or dysfunctions or not functioned anymore. So those kind of thing. In term 2, you just build your knowledge more on your term 1. So basically advanced nursing practice, communication, building on health promotion, farm and integrated nursing practice, more clinicals. Term 3 is again continued development in professional communication and practice with focus on variation in health and INP. Term 4, you further develop in communication, your HP, variation in health, with the emphasis on nursing practice and patient care. And then you're ready to go for preceptorship, transitioning your educational skills to the real world nursing, and where your skills get tested and you get experience hand-on, and then you're ready to go into real world and you land in a job. So overall, these are most of the colleges that are required courses, and expectations mainly from your schools are you are actively participating in classrooms, in the labs, which is more important, and clinical settings. Make sure you participate in your discussions, in debates, you are presenting your work. Mainly it is a group work, because working in team is a big thing in healthcare settings, and skill building exercises. Reinforcing learning from each level with the real world practice. Each term has a clinical placement where you apply your skills, and you get a passing mark from your instructor. You get to choose clients who are in facility, either it's a long-term or hospital, and you take the ownership of taking care of them, applying all the skills that you have learned in the class to that clinical settings, and you get the passing marks from your instructor. Your skills get checked out there. And finally, preceptorship. After you pass all those 4 terms that I mentioned, then you are graduating. You can apply for the nursing license required by your province where you are living in. And for BC, like in British Columbia, Canada, there is BCCNM, as I mentioned, British Columbia College of Nurses and Midwives, which establish and reinforce the standards of practice and ethical guidelines. And your college schedule or your school basically follows the requirements by BCCNM, and then your program courses and your criteria is based on the requirements that are established by BCCNM. BCCNM looks after your licensing process as well. They take any disciplinary actions as well if you're not following certain standards, if you're not following certain job title which are you required to, and if you're not following your scope of practice. BCCNM Also, they make policies, improvements for public's benefit, and they check your competence, if you're competent or not to perform certain tasks. And what you will learn basically in your nursing school is entry-level competencies for LPNs. So you provide safe and competent and ethical care. That is going to be your learning. And you're engaging in continuous learning to maintain and enhance your competence. You are learning how to think critically and how to use that critical thinking, your clinical judgment and knowledge of assessment to plan and evaluate care for your patients in future. You are learning how to provide culturally safe, person-centered care across the lifespan and practice collaboratively with other healthcare team members. So these are all the skills that you learn in your nursing school. And lastly, that is all. You apply for your NCLEX and you get your license. So that's all. You are ready to become a practical nurse, or you. So yeah, that's end of the video. And if you have any questions, you can go to Nurse in Focus and you can send me an email about your queries so I can explain more. And you can also follow my Instagram account, Nurse in Focus, to get more videos like this. Thank you.